My name is Deb Pallavicini and I'm the General Manager for Primary Care Advancement at the Sydney North Health Network. I'd also like to acknowledge Australia's Aboriginal people as custodians of the land and waterways, and we pay respects and recognise their unique cultures and customs and honour their elders past, present and future, and extend the respect to Aboriginal people attending this event tonight. So tonight we've got Train IT Medical doing the presentations for us. So we've got Katrina Otto, who is a practice management consultant and software trainer. She's had 30 years experience with a wide variety of medical practices. And then our other presenter tonight is Michelle Horswood, and she is currently a practice manager. She's also had 40 years experience as a registered nurse and still is a nurse along with her practice management. So I'm going to now hand over to our presenters.
Thank you. Thanks, Deb. Thank you. So hi everybody, and thank you for listening in tonight. I'm just going to start off by talking through the learning objectives for this evening. So our first learning objective is to explain where we're up to with the rollout of COVID vaccines in Australia. Then we're going to discuss COVID vaccine priority groups and the proposed implementation plans outlined in the COVID vaccination roadmap. We'll hopefully develop an awareness of the key requirements for practices involved in COVID-19 vaccination ordering, cold chain management and administration. We'll look at developing a practice plan for clear and confident communication with patients in relation to the vaccine. We'll identify some key planning issues for COVID vaccine clinics in general practice, and we'll look at ensuring practice compliance for documentation and reporting. So let's get started. So our first learning objective is to explain where we're up to with the rollout of COVID vaccines in Australia. I think we can all agree that the COVID pandemic's undeniably changed our lives, and being able to secure a safe and effective vaccine is of paramount importance to all of us. In November last year, the Australian government developed the COVID vaccination policy, and this was further revised and put out in about mid-December. I think it's really important. I'd encourage everybody to have a look at this policy. And the reason for that is that I believe that this policy underpins all of the plans that are being put in place. And if you have any question about where to find information or who's responsible for what, if you go back to this policy, it can be quite helpful to steer you in the right direction. Of particular importance in the wording of the policy is that the COVID vaccine will be free for all Medicare eligible Australians and most visa card holders. So for us in general practice, that means that not only will we have government funded vaccines, but we'll also have to ensure that there's no additional charge to the patients when they're having their vaccination. The other thing in the policy is it sets out clear lines of responsibility across Australian state and territory governments. And very broadly, the responsibilities for the Australian government are the overarching things like regulation of the vaccines, choice of manufacturers, transport to the sites in states and territories, setting funding policies, and ensuring data collection and monitoring systems are in place. For the state and territory governments, it's up to them to ensure that we have a qualified and appropriate workforce to administer the vaccines and to ensure vaccine sites remain compliant at all times in regards to ethics, safety and reporting obligations. The policy also tells us that the Australian Technical and Advisory Group on Immunisation are going to be responsible and have in fact determined vaccination hierarchy or priority groupings. and that the Australian Immunisation Register will be responsible for monitoring vaccine coverage. And this is important for us because we will be responsible for also reporting the vaccination to AIR, which Katrina will talk a little bit more about later. Some other important points outlined in the policy are that there's 3 vaccine candidates. So when the policy was originally published, as we know, there was 4, but now we're down to 3, being the Pfizer vaccine, the AstraZeneca vaccine, and the Novavax at this stage. So in addition to advanced purchasing of vaccines, the Australian government has joined an organisation called COVAX. And if you haven't heard of COVAX before, it's led by Gavi, which is the Vaccine Alliance, and it's a global effort to support supply of vaccines across internationally, so including the less developed countries. So Australia's contribution to COVAX was $80 million. And this will not only support vaccine supply in Australia as further vaccines are developed, but it'll also support vaccine supply in developing countries as well. And the other important thing for us is that the policy talks about primary care being at the core of the COVID vaccination rollout. And the reason for that is historically primary care, it's the major site of immunisation in Australia. And we have well-established protocols for administering vaccines, and we also have a well-trained workforce. So our next learning objective is to discuss the COVID vaccine priority groups and the proposed implementation plans outlined in the COVID vaccination roadmap. This was originally announced on the 7th of January. Scott Morrison held a press conference where he actually discussed implementation plans for the first time. So as I mentioned earlier, the ATAGI, or Australian Technical Advisory Group on Immunisation, were given the responsibility of developing the priority groupings. And what the policy said was that these priority groupings would be evidence-based, and they'd also be influenced by prevailing epidemiology. So what that means to me is that the plans can change if the epidemiology of the disease changes. And we have seen that, and we'll talk about some examples as we go further into the webinar. So we do now have rollout plans as per the ATAGI recommendations. We'll have a little bit of a look at those now. So if we look at phase 1A, which at this point in time is due to be rolled out later in February, we're looking at people who are considered at highest risk of contracting the disease. And the group, the quarantine and border workers, that is a good example of how plans have changed. They weren't in the original group 1A, but because there was prevalence of disease in this particular group and it was causing so much problem, that they then were included in group 1A. So it's planned that they will now have the Pfizer vaccine. And the other people are either at increased risk of getting the disease or at increased risk of something terrible happening to them if they do get COVID. So the next group, which is planned to be mid-March, is going to be phase 1B, which is the AstraZeneca vaccine. And that's the rollout that we've been talking about in general practice, and also the respiratory clinics, the Aboriginal health centres, and other appropriate healthcare settings. Phase 2A at this stage is programmed for May, and again it's also planned that will be AstraZeneca vaccine, hopefully manufactured in Australia, and that does include some more at-risk population and other workers that are essential for societal functioning. Phase 2B will be also at this point in time the AstraZeneca vaccine, and that'll be the remainder of the adult population. And last of all is children. And I think it's really interesting to see what's happening across the world in terms of priority groupings. And India, in fact, are vaccinating children first, so they're gone the other way around. So, assuming all goes to schedule, the roadmap at this point in time is that phase 1A will be the Pfizer vaccine. Now, we know that this vaccine has the ultra cold chain storage requirements of -70 degrees. So this particular vaccine, it's planned that it's going to be administered in hospital hubs in urban and rural areas around Australia, and they're to be secured by state and territory governments, or finalised by state and territory governments according to vaccine numbers and population size. And it's interesting, if you look at that particular roadmap, it's dotted all over the country, so it's going to be quite interesting how that works. And then phase 1B at this point in time, it is the AstraZeneca vaccine. And this is a vaccine for us that we're used to the storage requirements being between 2 and 8 degrees, so it can be stored in general practice. It can be stored in our usual refrigerators using the Strive for 5 cold chain guidelines. It's expected that the sites will be expanded to include our primary care settings, and we'll talk a little bit more about that later. I just wanted to mention that there's been a lot of discussion about efficacy in relation to this vaccine, and I wanted to ask people just to concentrate on good data in relation to that. There's certainly been a lot of discussion in the press, and we will rely upon the TGA to approve a vaccine which is safe and effective at reducing the incidence of death as a result of getting COVID, and also the incidence of severe disease. So we'll watch this space and see what happens in relation to that vaccine. And remember that the Australian government has agreed that they will change plans if they need to, but at this point in time, things are going ahead with the AstraZeneca vaccine. Now, we're all probably aware that there's been an expression of interest which closed on the 3rd of February for primary care, and I think it's really important to note that it wasn't any contractual agreement. It was, as it stated, an expression of interest, and many of you listening tonight may have completed the expression of interest form. We know that's going to be coordinated by the PHNs, but the PHN will then send off all of that data to the Department of Health, who will be responsible for determining which practices are involved in the program. So, and it's important that you know that, because I know certainly our Central Eastern Sydney PHN has been asked by a lot of practices if they're going to be involved. The PHN isn't aware of that as yet. I believe that the information has gone off to the Department of Health, and then they'll decide which practices will be involved. So we know from completing the expression of interest, if you have that, your practice needed to meet certain criteria. It had to be accredited. There were some site specifications that you had to adhere to. You had to be able to participate in the national booking system as it was planned at the time. You needed to have a qualified and skilled workforce to be involved. You had to be able to meet vaccine storage requirements, and you can see my beautiful fridge behind me that's empty, that I did originally purchase for influenza vaccines, but I've certainly got my fingers crossed that I'll have some COVID vaccines in there as well. You had to be able to commit to patient volumes, manage adverse events appropriately, and also be responsible for entering all vaccinations into EAR. And it's planned that the subsequent phases of vaccine administration will roll out to other primary care settings. So those who haven't expressed interest in the initial phases will still be able to participate further down the track. And it makes sense to think that we have to get so many people vaccinated the more practices that are involved in the long term, the better, and the more we're able to sustain that program. So hopefully we'll see practices who didn't actually put in an initial expression of interest for 1B become involved further down the track. Well, sorry, in terms of funding, we know that that's going to be, it's imminent, the funding model or the item numbers are imminent. We know from reading the expression of interest documents that the funding is an MBS fee for service with a PIP rolled in as well if your practice completes both doses of the COVID-19 vaccination course. So the fee for service will be most probably equivalent to around a level A, and the first dose of the vaccine that's planned will have the value of 2 bulk billing incentive item numbers included within the item number, so you won't have to claim them separately. That the way that was worded was a bit confusing. So the whole item number will contain the level A billing plus the bulk billing incentive items incorporated into one item number. And for dose 2, it will be equivalent to roughly a level A plus 1 bulk billing incentive item number. And if you do both encounters in your practice, then you'll get a $10 PIP. That's the plan. But as I said, the rollout of that is imminent, so it'll be interesting to see what happens with that in the next couple of days. So our next learning objective is to develop an awareness of key requirements for practices involved in COVID-19 vaccination ordering, storage and administration. So we know that we've got some new guidelines for vaccine storage in general practice. For any government-funded vaccines, we have to have a purpose-built fridge. We have to undertake mandatory cold chain management training, and that is, I think you only need one person in your practice to have done that training, but I think the more people that do it, the better. And certainly if you have staff that are involved in cold chain management, they really should be doing that training. And the other thing that we're told is that be prepared for random auditing, that we're wanting practices to adhere to guidelines so closely that they may come and audit us to make sure that we are adhering to what we've agreed to. So I wanted to spend a little bit of time talking about the key requirements for primary healthcare nurses involved in immunisation. And I know that I read the information about the mandatory training, and I'm sure that there's going to be a lot of confusion about it because it reads as though only immunisation providers can do the training, which would suggest that GPs and authorised nurse immunisers can do the training. However, I have it from word from APNA that the COVID vaccine will be a Schedule 4 drug. And what that means in general practice is that a doctor has to order it because it's a prescription medication, but registered nurses and endorsed enrolled nurses who aren't authorised nurse immunisers can administer it for the doctor. And of course also authorised nurse immunisers can administer it as well. It's not on the NIP at this point in time, so it's not going to be a vaccine that an authorised nurse immuniser initially can give independently of a doctor. But it sort of makes sense if we're wanting mass vaccination programs that may be something that happens down the track. But in the initial planning phase, it's not on the NIP. The mandatory training that's coming out for COVID vaccinations developed by the College of Nursing and approved by HESA, which is the Health Education Services Australia. That was live yesterday and I had a look at it, and at the moment the initial different modules that have been put out are predominantly pointed to Pfizer vaccination hubs, so there's a lot of information about storage and handling of the Pfizer vaccine. But down the track that will change for the phase 1B primary care settings, and the information will then be tailored for administering the AstraZeneca vaccine. In the interim, if you want to have a look at some really good training modules for giving COVID vaccine, and it deals with multi-dose vial issues and that sort of thing, and it's spoken as well as written, so I found it quite helpful. The World Health Organization have done training modules around giving the COVID vaccine. It's quite lovely if you've got some time. It says it takes 3 hours, but I did it in much less time than that, because you can flick through it, but it's quite good to do. So if you haven't looked at it already, take a look at it. It's quite valuable. Now, I wanted to spend a little bit of time talking about authorised nurse immunisers. Now, in New South Wales, the policy directives for authorised nurse immunisers were reviewed in December last year, just to bring everything into line in readiness for the COVID vaccine. Take a look at the policy directives, but I believe that the things that are discussed in those policy directives are important for all nurses in general practice administering vaccines. So I'm just going to spend a little bit of time talking about those things. So the policy directive tells us that all nurses should be up to date with their knowledge and their skills. So if you haven't administered vaccines for some time and you need a bit of brushing up, now's the time to do it. If you haven't, if you're not an authorised nurse immuniser and you've got a spare 100 or so hours, you might like to have a look at the courses that are available in New South Wales. That's the College of Nursing course, and also recently the benchmark course has been approved by HESA as a course that you can be authorised if you complete that course. There's a lot of scholarships happening at the moment, so look toward that. I know the Central East in Sydney PHN has a scholarship for the benchmark course, so I'm not sure if the Northern Sydney has a scholarship at this point in time, but it's certainly something to think about. And the College of Nursing often has scholarships as well, so take a look at all the options there and see what you can do. Otherwise, just upskill yourself as well. Now, think about insurance. I'm not saying that everybody should run out and have insurance, but I certainly believe that if you're a registered nurse in a general practice and you're undertaking any sort of autonomous functions, which we all do, I would highly recommend having your own insurance, as well as being covered under the practice indemnity. So the practice indemnity insurance will generally cover you for things that you do under the umbrella of a provider in the practice, but take a look at that and know what you're insured for and what you're not. If you're not insured, APNA does offer insurance, which can be combined with your membership, and it's very inexpensive. I think it's about $120 from memory for a year, but so have a look at that. I think that's an important thing as professionals that we think about. We also know that in Australia, nurses administering vaccines must do so as per the National Health and Medical Research Council guidelines and the digital version of the Australian Immunisation Handbook. And the important thing about that is that we don't give vaccines according to product information and guidelines. We go by our own national guidelines. We also have to adhere to National Vaccine Storage Guidelines, so if you haven't had a look at those new guidelines, now is a good time to do that. As immunisation administrators, we should have completed CPR training in the last 12 months, and I know in a lot of practices that's gone a little bit by the wayside with COVID and not being able to meet face-to-face and certainly practice CPR. So if you haven't done CPR training in the last 12 months, I definitely recommend that you look at doing that now. And also a good time to review your emergency protocols. Particularly, we don't expect more adverse events from giving COVID vaccine than we do from other vaccines. The actual incidence of anaphylaxis is 11 at the moment. The CDC are telling us that it's 11 people per million doses of vaccine administered. And if that's fairly equivalent to what the flu vaccine is also, and the data tells us that predominantly the people who do have anaphylaxis have known allergies. So there's not a lot of out of the blue rare anaphylaxis. But the thing that does happen most commonly with giving vaccines is a vasovagal or a fainting after the vaccine. So maybe have a little bit of a talk with your team about how best to manage those sorts of things in your practice. And of course reporting, which Katrina is going to talk quite a bit more to you about later. So I wanted to also talk a little bit about vaccine administration, and this is going to be in the mandatory training that you do if you're involved in giving the COVID vaccine. And we know that the COVID vaccine comes in multi-dose vials, which has a little, a few extra things to think about. The AstraZeneca vaccine has 10 doses in a vial. So if you're managing vaccination clinics, you've got to think around groups of 10 people and how long the vaccine can be out of the fridge, etc. And the other important thing, if we're thinking about a vaccine where we've only got limited supply, which we do, we want to make sure that our dosing is accurate. So we need to try really hard not to waste vaccines. So if a vial has 10 doses, we need to really try and ensure that we get 10 doses out of it. And the other thing about multi-dose vials is there's some other, tricky things to think about in terms of infection control. And the training, I know the World Health Organization training certainly covers that. And I'm sure that the mandatory training from the College of Nursing will also talk about that as well. And we have been told that it's not necessary to order extra disposable items, and I know this was an area of concern early on where people were very worried about how they would try and get enough syringes and needles to give the vaccines, but we're told that the AstraZeneca vaccine will come with the needles and syringes. And for those of you who have been around long enough to remember the H1N1 vaccination program or the swine flu vaccination program, that was the last mass vaccination program we've had in Australia, and that did come with the needles and syringes as well, which was quite helpful. I also wanted to talk a little bit about adverse event reporting here, and we can see from the slide that's our national adverse event reporting form. There was some talk, and certainly in the World Health Organization training, about having a specific COVID adverse event form. I haven't heard anything about that since, so if anybody does know or has heard any of that information, I'd be really interested to find out. But I had another look at our adverse event reporting form, and it really covers us to be able to add in the information in relation to COVID vaccine if that's the form we use. Before you complete the form, just touch base with your primary health network about whether your form goes to your local health district or straight to the TGA, and that's different according to which health district you're working in. So just try and find that information out now before you need to complete it and send it off. And we know that data collection for this particular vaccine, because it's a new vaccine and there's a lot of talk about safety, it's going to be important that we accurately record any adverse events that we know about. So that's the document that we use. And the other thing that I wanted to talk about was AUSVAC's safety. And I don't know if any of you have been involved in programs like this before. There's one called SmartVax, and there's another one called Vax Tracker that I'm aware of. And what they do, they collect data, and AUSVAC safety has been designated with the responsibility for collecting data about the COVID vaccine side effects. So in your practice, you would enroll patients into this particular system. So when you're consenting them for vaccination, you would ask them if they would agree to participate in having data collected about their side effect profile. And if they consented, you would then have to enroll them in the system and either add in an email address or an SMS. And then certain periods of time after they received their immunisation, they would get a notification asking them if they were experiencing any side effects. And I think if you can participate in something like this, it's really valuable. Ausvac Safety collected some wonderful data for the 2020 influenza season last year, and it's hoped that we'll get good data from them about the COVID vaccine. And we all know that if you get a message on your smartphone and you just have to press a couple of buttons to answer questions, that it's a lot easier than completing other sort of written information and things like that. So I definitely encourage your practices and your patients to participate in that. So our next learning objective is to develop a plan for clear and confident communication with your patients in relation to the vaccine. And this again is going to be really important for COVID vaccine because it's a new vaccine. And we want our staff and our clinicians to be able to give patients clear, confident and consistent messages. Now, the Department of Health have put out a lot of information packs for primary care settings. And there's handouts to give to your patients, there's posters to put on the wall, there's recommended social media messages and scripted things that you should put on your social media platforms. So if you haven't had a look at that yet, I would definitely take a look at that and utilize that in your practice. There's wasted time trying to write things yourself if it's something that's already being developed and you can easily access it. That's the patient information packs. The other thing is that using the patient information packs, I always recommend getting a little laminated card and maybe putting a little script in response to certain questions, so that when your administration staff are at the reception desk and they get a phone call, we don't want them to answer clinical questions, of course, but if there's any frequent questions that you think might be helpful to have a scripted response to, I definitely recommend doing that so that everybody's giving the same message. And you as nurses and practice managers, if you can stay up to date and knowledgeable, look at your PHN daily or weekly, whenever you get a chance, to see the up-to-date information in relation to what's happening with the COVID disease prevalence and also what's happening with the vaccination, so that you can then impart absolute, clear and confident information to your patients, as well as the other staff and the other clinicians in your practice, because there's a lot of conjecture around, particularly in relation to safety. I listened to a talk in about November last year by Patrick Cashman and Jodie Stevenson, which are two immunisation people from the Hunter, New England area, and how Patrick described safety when he was talking about the development of the COVID vaccine was, he said that usually vaccines are developed in a linear fashion, so one step after the other. But with the COVID vaccine, because there's been such massive resources put into it, they've been able to develop the phases of the vaccine all simultaneously. So there's been no compromise of safety. What's happened is that it's all just happened simultaneously instead of in a linear fashion. And I thought that was a really good way of describing the way that COVID vaccine's been developed, and I've certainly utilised that way of describing it. So if you think that's helpful, I think that is a good way of communicating the safety message. So our next learning objective is to identify some key planning issues for COVID-19 vaccination in clinics in general practice. So the first thing I wanted to talk about is your vaccine storage capacity. So now's the time to take a look at that. We've all seen fridges that look a little bit like this one. So I'm not suggesting that everybody runs out and purchases a brand new empty vaccine fridge like the one that's sitting behind me. But look at your government stock. Firstly, we know that you can order government stock on a monthly basis. So have a look at your government stock and see how much you've got in your fridge. If you've got 3 or 6 months supply, you don't need it. Pare it back down, maybe 6 weeks at the most, so that you've got room for not only for your flu vaccine, but also hopefully for some COVID vaccine. And we know that we're going to get COVID vaccine during the influenza vaccination season, and also that we often have to pre-order all of our private stock these days. And I know probably for the last 3 years at least that unless I've pre-ordered influenza vaccination stock, I'm not going to get it. So I purposely order lots. And if you've done that, then think about where that's all going to go. We know that government funded vaccines have to go into a purpose-built fridge. So think now about what room you've got and how you can free up some storage capacity in ways other than just going and buying a new fridge. But if you do need a new fridge, well, maybe now's the time. The other thing that I would recommend is considering your workforce. So consider who can vaccinate in your practice, who can participate in the vaccination clinic, and how that's going to work. Do your staff need upskilling, or do you need to get more staff? Now's the time to think about that. This is a lovely planning group here that you can see. This slide, the picture here is from Katrina. It's a clinic that she works in, and you can see that everybody's sitting around having a discussion about planning. They've got a notice board where they've put information at the back there. It's lovely to see that sort of planning going on. Think about how you're going to advertise and promote the fact that you have COVID vaccine in your clinic. There is advertising materials available, as I said, via the Department of Health, and the link is after on the presentation links for this webinar. Have a look at that. Adopt the social media pictures and scripts if that works for you, or posters and things. But think about that now and chat to your staff about how you'd like to go about doing that. Probably the most important thing or important consideration is logistics for your clinic. Considering that we have to maintain social distancing and we want to be able to vaccinate a reasonable number of people in any given session. So just think about how that's going to work. Maybe think about waiting areas, think a little bit outside the square. Is the waiting area the only place that you've got for patients to wait? Is there somewhere else that they can wait? How are they going to all wait pre-vaccination in one area, post-vaccination in another? Do you have the space for that? Think about those sorts of things now. Have discussions with your staff and come up with some ideas about how that's going to work, and also some ideas about how you can make that easier. My little pink cards have become a little bit famous over the last few months. What I've always done, and I learned this at a talk that I went to years ago, is to, when you vaccinate a patient, to give them a card, a laminated card that's got the vaccine that they had on it and the time, and tell them that they've got to go and wait in a certain area with their card in their hot hand, and in 15 minutes they can take that card to reception. And that serves a couple of purposes. One is you're easily able to identify the person, particularly if they've got a hot pink card. And secondly, if it wasn't a COVID vaccine, if it was a vaccine that the person had to pay for, that then tells reception what they've had. So think about what you can do with those sorts of things to make things easier. Think about your appointment structure, how it's going to work. Are you going to have nurses and doctors working together? Are you going to have, we know that the doctor has to order the vaccine and certainly participate in the consent giving process. So think about how that's going to work. How long are you going to have for your appointments? All important things to think about now. Think about the amount of PPE you need. We don't need to be in full hazmat suits to administer a vaccine, but the World Health Organization does recommend that we wear gloves, that we wear masks, and we wear eye protection. For immunisations, routinely in the past, gloves haven't been an absolute recommendation, but I would think, given the nature of our environment at this point in time, that it's probably prudent to wear masks when you're vaccinating in a COVID vaccine clinic. Make sure you've got sound patient recall system. The national booking system isn't going to be recalling patients. It's not going to be booking patients. It's going to be a directory. So think about how you're going to get your patients back in for their second dose, not only because we want to vaccinate them and complete their schedule on time, but also, sorry, that's gone in my head, also so that you can schedule them and get them back in for their schedule. Sorry, no, I've got it. For their PIP. You want to make sure that you get them back in so that your practice gets the PIP payment as well. I've put vaccine supply here because I think it's something I can't confirm with you now, but I think it's time to think about it. If you're going to give a patient their first vaccine, how are you going to ensure that their second vaccine is available in your practice at the time that it's supposed to be given? I would usually, in that situation, I would quarantine their second dose. So I would give a patient a vaccine today, put aside their second dose to be given in 4 weeks' time. That's certainly a conversation that we would need to have further down the track once we get ideas about how the supply is going to work, because we don't want to be giving our patients, if we can help it, the vaccine outside of schedule, because we want the efficacy to be of paramount importance, and so we want the vaccine to be given on time. Billing in your practice, again, we talked a little bit about the funding model, but we know that we can't attach any charge to giving this vaccine because it has to be free for all Australians. But we do know that we can, if there's another service undertaken during that encounter, that can be processed as a billing item. But I would think if you're doing vaccination clinics and trying to have a high capacity, that you're probably not going to be wanting to do other things, but now's the time to talk about how that's going to work. Documentation I'm going to leave to Katrina to talk about, but it's very important that you make sure that your vaccination's documented and that your patient has documentation of their vaccine as well. Very, very briefly, because I know we're running short on time and I don't want to cut Katrina's part of the talk off, is that now's the time to think about your vulnerable patient groups. Are all of your patients going to be able to get into the practice for you to be able to administer vaccines? Last year, we undertook a home vaccination program here at O'Connell Street for vulnerable patients that couldn't leave home because of COVID. So now might be the time to have those conversations and think about how that can work in your clinic. So that brings us to our last learning objective, is to ensure that your practice is compliant for documentation and reporting. And I'm going to hand over to Katrina to talk to you about that now. Thank you.
Wonderful. Thanks so much, Michelle. And Amy, awesome job on the questions there, answering all the questions for everyone. So I'm going to talk really quickly because there's a question I can see that I'd really love Michelle to share her experience as a practice manager at this point in time on. I just want to talk to you about the technology, documentation, communication, because there is a lot happening with technology at the moment to help you with the COVID vaccines. So when it comes to number one thing I really want to stress is the AIR. Now, the AIR has been given responsibility for monitoring vaccine coverage with COVID, with all our immunizations now needing to be reported to the AIR. So this is absolutely essential that we do our part and we upload that information. Now, I am very, very hopeful that you will be able to use your usual practice management software. And if there wasn't 300 people online at the moment, I would say, tell me, what do you use? Best practice, Medical Director, Communicare, Genie. Very hopeful that the existing functionality, the client adapter that sends your current immunization data through your software to the AIR will be the same for COVID. Now, I don't like to speak out of turn, so I do have a statement from Best Practice and Medical Director here. So I thought I will read it. It's from them. So what will happen is when a COVID vaccine is entered in the Add Immunization window, a new serial number field will be available. So this is the key difference I really wanted to share with you all, okay? So it's anticipated the practice will scan a QR code on the vaccine vial to read the serial number. So there's a few third-party ways to input that serial number, and we're going to be hearing a lot about this, so I don't want anyone to stress. Could be even as simple as the webcam that you're looking into right now, a camera phone. Just hold off till you get more information about that. It's a rapidly developing tech space. Saffron, Best Practice Saffron, it's got included a hidden feature. So when we do have the vaccine available, there'll be an data update, and that will release that hidden feature. Medical Director, they have set a new release. Medical Director 4.1 will be available in the coming weeks for practices that wish to participate in COVID-19 vaccinations. So you will have access to the new technology, the new functionality, and again, you'll scan the barcode on the vial, which will populate your software, enter any remaining patient fields, and that will go to Praxsoft as usual. Communicare also, I heard today, has updated Telstra Health, of course, owning Communicare. We're seeing emerging software rapidly being developed to help. Your software manages, of course, your immunization data. When it comes to documentation, consent, when something's new, and I mean, I've been training software, I train Medical Director and Best Practice, and I have done for 20 years. I work with the indemnifiers. When anything's new, over-document, over-communicate. So now's a really good time to ensure that you do have your latest update of your software so that you're ready, so there's not a massive upgrade. And that's just really good for your progressive practice of the future anyway. It's so important, this technology. Recall management, clean it up. We need to be able to use our software to easily identify our priority groups. Now, we can do that, of course, by age, but we really want to be able to use our data to look at our vulnerable groups, patients with chronic conditions, our patients who have identified as Aboriginal and or Torres Strait Islander. We want to be able to efficiently streamline our systems in order to communicate and manage the process. Similarly, we'll have our templates, our checklists, our shortcuts to use to document not only what information you've given, what patients have consented to, but what questions they've asked and then what answers you've given. So this is all really important to think about and talk about as a team right now. You'll see a lot of software being developed. I mean, if you use, I imagine you do, I hope you do, we use one of the data analytic, more advanced, I guess, data analytic programs like Penn or Polar, Cubico. These programs help us really visualize our groups and better manage. And they are all rapidly developing features to help us with this. If you use online booking, like HotDoc, AutoMed, Health First, they've all got new developments happening. AutoMed has a vaccine management feature that is ready. So I have a look at the technology. When it comes to the possibility that you won't be a practice in the initial stage delivering vaccines, your patients may need to go elsewhere to have their vaccine. So this is where it's just, now's the time to talk about this as a practice. What does that look like? What does that feel like for your practice? How are you going to answer questions and communicate? I keep telling everybody, don't stress about that. I mean, if your patients, they're committed to your practice, they will come back to you. They're not going to leave because they have one vaccine at another practice or a vaccine center or a pharmacy. So the key aspect is communicate as you develop. As Michelle said, this is a continually evolving space. We adapt and pivot according to the information we have available. And that's something that you can take your patients along for the journey with you. Much better than not giving them information. And that's why I shared that picture of the staff room wall. That's Queen's Mindari Super Clinic, one of the practices in Western Australia that I really admire, I've worked with over the years. Have a look at what other practices are doing. Don't reinvent the wheel. Use the social media images to educate and include patients in the conversation. Get their feedback. And then when you're ready to deliver the vaccines for your patients, then it'll hopefully be a whole lot less phone calls. Our national booking system, as Michelle said, is, talk about rapidly changing information. The important thing there to know is you will manage your patients. You will contact them, you will book them, same as we do now. What is important, it was important before this, but it's extra important now, is that you register your practice with the National Health Service Directory. That's something that is good to do anyway, because that works with secure messaging. So another doctor being able to see you on the directory and securely send patient information. So numerous helpful features, but when it comes to our patients being able to see, well, where is an approved vaccine centre, that's going to link into the National Health Service Directory. So watch this space is the advice for that. Ensure your software is updated, you're communicating with your team, ensure that you are listening to what your vendors are saying with their software development. Look at some new technology. And if you haven't thought about it recently, now's a really good time to look at uploading your health summaries to My Health Record. Number one, you get a PIP payment, PIP-QI, for improving your data quality. You get EPIP for uploading to My Health Record. You'll get double PIP payment if you are doing both vaccines to your patient. But importantly too, if your patient sees another doctor, having that health summary uploaded to My Health Record, if your patient has one, and it's recent, accurate, that's going to make it safer, more efficient for your patient and the other doctor, and easier to manage. If you think you will be seeing a lot of patients who are not known to your practice and having to collect all that health summary data, how helpful would it be to see an accurate health summary from their usual GP? Now, if a patient doesn't have My Health Record, of course, we will still need to give them their access to their own information, specifically in relation to the COVID vaccine. Now, I was just posting yesterday, I use an app called Healthy. I can see my immunization data now. The COVID vaccine will just add to that. prefer to see it on my phone rather than a piece of paper, but of course, within your software, you can easily print vaccine immunization summaries. So watch this space, keep your software up to date, use this time if you can, maybe improve the health summary data, upload to My Health Record, and start the, the team conversations in your practice. How's this going to look for you? So on the next slide, we have all of the links. Now, the reason we have the links here is we encourage you to download a PDF of this presentation. We've covered a lot, and that way, if you think, well, I just want to go to the information on this aspect, you can just click on the link, share it with your team. There's a lot of really good sources, and because there's a lot of misinformation and we want to stop that misinformation as quickly as possible, always go to the source for that up-to-date information. Now, I also, on my website, trainitmedical.com.au, we are very good sharers at Train IT Medical. Michelle leads our nursing team, and this is updated just about daily. So we've now got a training section on there where we list all the online courses that you can do. I was just doing the mandatory training one today myself, and as a non-clinician, I'm practice management, I recommend all of your admin staff, absolutely important that they do that training also. Fills in a lot of gaps. It's not covering the Pfizer vaccine clinical information for admin staff. Get them to generate that certificate. It's going to be compulsory for everybody. So thank you for inviting Michelle and I. It would have been lovely to be over there with you. Michelle and I are both from Sydney. So next time, perhaps we'll be with you all in person. Please connect with us. We do post, we share samples of wonderful ideas and wonderful initiatives from other practices on our Facebook, LinkedIn, Twitter, and we thank you for inviting us and look forward to working with you as we start to vaccinate Sydney.
Thank you, Katrina, and thank you, Michelle. And also I'd like to thank Amy, who is our nurse coordinator at SNHN, for assisting with answering questions. And thank you everyone for attending this evening.